Assalamualaikum and a very good afternoon to all our viewers on Facebook. For today, we have our consultant arthroscopy and sports surgeon, Dr. Badrul Akmal Hisham, Muhammad Yusof. Assalamualaikum, Dato.
Waalaikumsalam.
Welcome to our little studio. So today, Dato, we are gonna speak to our viewers on if they're interested in stem cell treatment, can they receive stem cell treatment for their knee pain? So to start off, can you please introduce yourself?
Thank you, Zal. My name is Dr. Badrul Akmal Hisham. I'm an orthopedic surgeon in Hospital Chancellor Tuanku Mughris, UKM Medical Center. I'm a senior lecturer and consultant orthopedic surgeon specializing in arthroscopy and sports surgery. And today we are supposed to be talking about stem cell treatment for knee pain. Yep.
Okay, Dato, maybe we can start off with, because I know a lot of our viewers are interested in the topic. Maybe we would like to start off with what is stem cell?
Okay, stem cell is a cell that is actually one of your type of cells in our body, and the main the main function of stem cell is to repair and regenerate into special type of cells, meaning to say it is actually a cell that can change its function to become a specialized cell. So we have in our body, we have basically two types of cells. As an adult, we have mesenchymal stem cells and hematopoietic stem cells. Right. So these two types of cells actually are within our body, and is being replenished from time to time, and it repairs. It is being used to repair certain organs that is injured or that is actually being replaced. And for instance, mesenchymal stem cells will be able to change its function to become muscle cells or bone cells or cartilage or even nerve and fat cells. So this is what we call mesenchymal stem cells. Whereas the other type of cell is called hematopoietic stem cells. And these hematopoietic stem cells derive from mainly the blood and from the bone marrow also. And these hematopoietic stem cells, they can become the cells of the blood. For instance, they become the red blood cell, the white blood cells, and mainly the white blood cells actually, and platelets as well. So these are the cells that these hematopoietic stem cells can become. Right.
Okay.
So there is another type of stem cells that actually we can understand, but it is more of it is not with we do not have that. This is called the embryonic stem cells. So these embryonic stem cells are the cells that is actually exist in a fetus, or rather when you are not a baby yet, you're not become a baby or you're not born yet. So the fetus actually has got all these cells called embryonic stem cells. These are all primary cells that actually can become even more a wider range of organs. So these embryonic stem cells are the ones that has got the potential to become a lot of other organs. So they can only, or they only exist in embryos or fetus.
I see.
Okay, this is the one that is actually quite controversial in terms of use or in terms of research, because they tend to become something else.
I see. So there's the mesenchymal stem cells, hematopoietic stem cells, and also embryonic stem cells.
Okay, yes, but in adults, when we refer to adult, is mainly the two things, the two which is hematopoietic and mesenchymal stem cells.
Hematopoietic and mesenchymal.
Okay.
So, Dato, you seem very passionate in stem cells. So, we'd like to know, like, as a doctor, how did you become involved in stem cell research?
Okay. Well, historically, I was a trainee in doing our the specialist program back in year 2001 until 2005. And within that period of time, we were part of our requirement in order to become a specialist. We are supposed to do a research project, and that research project was actually we were the first two researchers from our department, orthopedic department, myself and my colleague who is Dato Dr. Azmi Baharudin. So both of us were well, technically we were instructed to join the tissue engineering lab that was actually started in 2002, if I'm not mistaken. So under the supervision of Prof. Dato Ruzima, Prof. Sharaf, Prof. Dato Muhammad Razak, and Dr. Aminuddin Saim. So at that time, it was a tissue engineering lab, and we were quite excited. At the same time, we are quite in the dark of what actually tissue engineering. But as Dato Professor Ruzima and Dr. Aminuddin Saim came back from Harvard, they learned the tissue engineering methods, how to grow cells and to be organs, to become organs. So at that time, like Dr. Aminuddin Saim is a ENT surgeon, and they were growing ears and nose or something like that. That actually has got cartilage. So when Dr. Umar Razak asked me and Dr. Azmi to join the lab and to do research, we were tasked to grow articular cartilage from discarded or broken tissues of human or patients that we get from during the operation during surgery. For instance, in orthopedic, patient has got was treated for fractures, and we find a piece of cartilage that actually came off. So we get the cartilage and brought it to the lab, and we grow. First, we isolate the chondrocytes, meaning the cells that actually forms the cartilage, the articular cartilage, and from there we grow the chondrocytes to become a three-dimensional structure of human-like articular cartilage. So that was how it all started. So our experience for nearly 2 years of doing lab research work actually stimulated our thinking and our understanding that actually in reparative and regenerative medicine, actually it was then a very big thing that holds future. And from then on, there were many other research that is being done from the group Tissue Engineering Lab, and it went on to become Tissue Engineering Center. So there were many other researchers after that that involved in formation of the bone, regenerating cartilage, nerve, and everything. So from then, we started with growing in the lab, and then animal studies, and big and small animal studies, and big animal trials. So that was how actually UKM since 2002 until 2016 that we managed to be able to be in the front of this research in cartilage.
See, Doctor, that was 18 years ago.
19
years ago.
This whole thing was not actually overnight, like last year or 5 years ago. Actually, it was a slow and tedious process and that involves a lot of money and a lot of time and effort and a lot of brains. And I think our our leaders at that time have got this vision that UKM should be the center of this new technology, which is supposed to be trailblazing, that we're supposed to trailblaze, which is the reparative and regenerative medicine, even during that time.
So, Dato, since you've been spearheading, if I'm correct to use that word, spearheading stem cell research in knee pain. So, since we are also UKM Special Center is offering stem cell treatment for knee pain, a lot of our viewers would like to know. So, is it painful?
Maybe before that, I will just share how actually being a researcher proper and also an orthopedic surgeon actually made us quite a hybrid kind of doctor, because what we do actually, we see patients, right? As doctors and as surgeons, we see patients and we have to treat them. And most of the time, in orthopedic, they have fractures, they have joint pains and joint problems. So, from our perspective, patients who have got problems in the joint and bone, mainly the objective will be quite straightforward. First of all, is to alleviate pain, and number two is to get them to return to function. All right. So, with these two main principles of management, we are supposed to be sorting out and settling most of the orthopedic problems. But given our opportunity to be involved in cartilage research and tissue engineering during our early training days, we were able to appreciate more of what actually is happening at the cellular level. Rather than just, as you know, orthopedic surgeons, they are like, some people say they are like carpenters,
They're good with their hands.
Yeah, good with their hands and use screws and
Yes.
plates and everything. But because we have seen how actually molecular and cellular research help us to understand more, and this understanding actually give us a more insight and holistic view of the problem that the patients have. Because, for instance, everybody knows that for cartilage, for articular cartilage, especially in the knee joints and other articulating joint like the shoulder joint or hip joint, they the particular character of this cartilage is that once they are injured, they are not able to get back to the normal state, as in they will not be able to attain 100% of their original function and original structure. This is mainly due to the fact that cartilage has got a very unique character of being strong. It is strong and it is actually able to withstand forces and shock, and at the same time it allows smooth movements between the joints. And but once it gets damaged due to either trauma or mechanical injury or some other problems like infection and osteoarthritis, so they are not able to get back, to the normal structure. And if this is actually a process that is quite debilitating for the patient, because the main problem will be pain, and then after that patient is not able to walk and patient is not able to function. So from this from this view, all this while, if we take knee pain or knee osteoarthritis, okay, primary knee osteoarthritis mainly is because of aging and of course degenerative. Some people get it at the age of 60. Some people get it 50. Some people does not even get it. Right? You have got risk factors if you are heavy, or if you have done a lot of activities, vigorous activities during your younger days, such as you run marathons and do hiking and everything. So all these actually will accelerate the damage of your cartilage, maybe earlier than when it usually is.
When do you know that it's time to get? Let's say I'm 30 and I go hiking every week.
Okay.
Should is how and when, like, should I know it's time to treat my knee pain?
This is the best part because um, we first and foremost we know that when after a hike, even normal people after a hike, if we let's say we have 10 people, two of them will feel the pain and feels normal. About six of them, they feel pain and they have to rest for a few days. Another two of them will feel pain and will never do it again. So from this, if you can understand, pain is very subjective, right? Depending on your level of performance and your level of pain tolerance, and of course your body type and other associated disease or problems. So a lot of people will regard pain as part and parcel of the process. Like like when kids growing up, we call it growing pains. So if you go for hiking and then if let's say going up Gunung Ledang or Kinabalu, so you will have a few days to rest. You need to have a few days to rest. So as we go along, what we can see is that if the pain is chronic, meaning you keep on having the pain and then it's associated with swelling, and then or if the pain becomes unbearable, so those are the red flag signs that you might need to have your knees checked or see a doctor. All right, and of course, if you have injuries such as while playing football or netball or anything that twists your knee, then you had a pop sound. Usually, it's either your anterior cruciate ligament that is torn, or even you can also damage or injure your structures within your knee joint, such as your meniscus or your cartilage. So all these actually can give rise to a much more accelerated condition for the cartilage to wear off or to degenerate.
Okay. That's what you mentioned. Like if you are a sportsman or when you feel pain, and there's a different types of pain, and it depends on individual. So let's say if in diabetics, can they take the stem cell treatment
Oh.
in diabetics?
Basically, there is okay. Um, Before that, a bit about the stem cell again. Um, our own our own body produces our stem cell for our own use. All right, but it is not in a very big amount because mainly, it is being produced in small amounts, enough to repair bits and pieces, like repairing your house. When you have leaking, a small leak at the roof, okay, and then you patch things up. So these are the main function of stem cell. But if the whole roof is broken, then you might need to change the roof, kind of thing. All right.
Okay.
So there are conditions whereby, because what the stem cell, for instance, mesenchymal stem cell can do, it can repair your muscle, it can repair your bone, it can repair your cartilage and other structures. So these mesenchymal stem cells are being constantly produced. But as we grow older, our capabilities of producing enough mesenchymal stem cells, and even good quality mesenchymal stem cells has become much less. All right. So everybody knows this, that we, for instance, if you want to take, if you might want to ask me, where do we get our own stem cells? All right. So for mesenchymal stem cells, we have in the fat, in our fat tissue, and then we also have the mesenchymal stem cells in the bone marrow, and then in our synovial lining, and yeah, in the bone, in the periosteum. So these cells are strategically placed in areas where they are being able to mobilize to do the repair.
I see.
And for instance, it is a known fact that if we have, for instance, a fracture of the bone, a long bone fracture, and it is actually not uniting for reasons maybe slow to unite, okay, the bone does not connect after a few months. We know that if we take the bone marrow and then inject at the fracture site that is not uniting, it can be promoted. No, the bone marrow that is being injected can promote the union of the bone, and this has been proven that the stem cells from the bone marrow is able to help heal the bone that is slow, that is uniting slowly.
I see.
So where does this the whole thing go about? Is the turning point was when we started to isolate and work on stem cells that we got from the umbilical cord. All right, this is the turning point, I think, for UKM's stem cell research, especially in orthopedics, whereby we are able to isolate mesenchymal stem cells from the umbilical cord of newborn baby. All right, and like you, what I mentioned before, this is not embryonic, because this umbilical cord is considered already belong to a baby. So it is considered adult mesenchymal stem cell.
I see.
So this mesenchymal stem cell from the umbilical cord that we use, the best part was it is able to be given to a non-related person. Meaning to say, if a person comes to in our research, we have embarked this on our research back in 2016 and even before that. Our patient responded well in getting allogenic, meaning stem cell that is being sourced out from a non-related donor. And these stem cells that we got from the umbilical cord is being grown in the lab, okay, a specialized lab called, a tissue culture lab that is has been verified and certified by the relevant bodies and with good manufacturing practices. So these cells are being grown in number of millions, about 15 to 25 millions, and being injected back in the knee joint. So, okay, what we have then is that we have a huge number of mesenchymal stem cells to help the repair of the articular cartilage tissue.
Okay, so we have some questions from our viewers.
Okay.
Hi Dato, my father was a football player when he was young, and he had arthroscopy done. Now he is 70 years old, and could you please suggest if he can have this treatment, this stem cell treatment?
He is 70
So he is
years
70 years old, and he had arthroscopy done, and he was a football player. Is he a right candidate for stem cell?
Okay. First and foremost, stem cells. From our research, we first and foremost the patients have got to have the symptoms, knee pain, all right, and then of course some patients have got a certain degree of osteoarthritis. Okay, osteoarthritis is the condition whereby your knee cartilage is worn out, and eventually, when the pain is unbearable and the knee is deformed, then most of the time, when all else doesn't work, medication doesn't work anymore, and so on, patients are offered total knee replacement, for instance, meaning changing the knee to a metal joint. Right. So usually, this is an acceptable practice for patients who are 60 years and above, because when you do a knee replacement, usually it can last about 15 to 20 years in terms of the fixation or of the metal. All right. For the patient of our viewer who is 70 years old, basically the age, well, we've never really injected in a 70-year-old, but if it's like he doesn't want to go for a knee replacement, and he's in pain, and he has got multiple problems like heart problems and so on, yeah, he might be a candidate for our research. For your information, we have done research for articular cartilage injury, and also for osteoarthritis, and the treatment or the therapy using mesenchymal stem cell.
Okay, Dato. There's more questions. So, Dato, we have, let's say a patient has other medical issues, such as high blood pressure, heart problems. Can they opt for stem cell treatment?
Okay. In fact, the second patient that was our subject or clinical trial patient. There was this patient from Bertam, Pulau Pinang. He was diagnosed to have bilateral knee osteoarthritis and was supposed to go for surgery, but before he was able to go for surgery, he had a heart attack. And the heart attack actually was so severe that he had to go for open heart surgery. Okay, so as we know, after a heart surgery, you are not the best candidate to go for any other surgery, because your heart is not as good. And the problem was, he still had the bilateral knee pain due to the osteoarthritis. So it is actually a situation, a catch-22 situation, whereby he still has the pain, and of course the pain can give stress to the heart. So he was actually one of the candidate that I think is very suitable for this kind of treatment, because with this treatment he does not have to go for a knee replacement. And in fact, we injected both his knees a few months apart, and now Alhamdulillah he is able to even climb the stairs and do a lot of things. And Alhamdulillah, he's very happy with the knee joint, with his knees. And the good part is that he does not really have to take painkillers, because as we know, painkillers actually is not good for your heart sometimes, especially when you already have a weak heart.
So since we're on the subject of treatment, the viewers would like to know like the duration of the treatment.
Okay, our second study, for the first study we did was there were 6 subjects, 6 patients, and these 6 patients have got large and multiple articular cartilage injury, right? Currently, the standard treatment for cartilage injury, there are a few that is being widely used or widely utilized. But for multiple and large lesions, there are not many method that can address this problem. So we embark on this specific problem in order for us to hopefully come up to a conclusion that it can be safe, because most of the time these patients are quite young as in they are in their 30s or late 30s, and usually they have sports injury at a younger age, at their teens or early 20s, and by the time they are 30s and before they become 40, they already have a bad knee. And as we know, to replace your knee with a metal knee, you are supposed to be at least 50 or 55. In some European countries, they do not allow knee replacement to be done anyone below 50. So if, let's say, for instance, you are at the age of 35 and you have a bad knee, and I don't think you should be suffering for 15 years before you change your knee to a metal one. Okay, so because by the time you'll be depressed and you'll be, having all sort of other complications, like when you have knee pain, and then you got back pain, and then you have to take painkillers, and then you have to take steroid, and then all sort of things. So these are the candidates that we look for, and the first 6 patients that we have actually responded very well, and it was an approved study by UKM Research and Ethical Committee. And we then, after the first study in 2016, we embarked on the second study using injections only. But this time around, the subject or the patients that we looked for were patients that have got osteoarthritis of the knee. All right, most of them have got both sides. There were 14 knees that we injected. Some we injected both knees, some we injected one knee, and we were quite happy. And of course, the patients are very happy with the results, and we have presented in various conferences. We injected only once actually, and they responded quite well. And then the duration where the effect actually takes off is about up to 3 months to 6 months. And of course, it's not just the pain that goes off. The patient must also do their part by doing certain exercises to strengthen the muscle. The problem always is that when they have joint pain, such as the knee joint pain, they are not able to exercise. When they are not able to exercise or walk properly, the muscles also does not become big, or rather it becomes weak. So when you have a weak muscle, it actually make the knee joint pain becomes much more worse.
Okay. You mentioned the duration is the duration of the treatment. The treatment is about 3 months. Is that right?
No. We injected once.
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 Okay, so that's all you need.
Yeah.
That's all you need.
Yeah, I'm afraid
Sounds too good to be true.
Yeah, it sounds too good to be true. Yeah, but that was it.
I see. So this gets more interesting because we have now about 90 viewers, and we have a lot of questions. So okay, the next question would be, okay, how about an adult who is 60 years old and needs a total knee replacement? Do we have an alternative?
Yeah, honestly, there are many patients who comes knocking on our doors and asking the same questions, I would rather say, well, bluntly, yes, it is an alternative. Because why do I say it's alternative? Because it's not entirely uh, uh, a solution compared to knee replacement. But as we know, knee replacement has got its merit, and there are patients who are indicated replacement, but there are patients who do not want to undergo this surgery, which only the reasons only known to them. Some I can understand, some I may find it difficult to understand, but we always have got to respect the patient's decision that some patients just do not want to go for knee replacement. So what alternative do they have? I would say there's not much, because apart from modern medicine, which is painkillers and supplements, the ones outside, and of course physiotherapy. But with pain, you can even do physio. So the ones outside that is actually offering them all other alternative treatments, either TCM or whatever. And also these patients are quite desperate for anything that can be a miracle cure for them. And I'm afraid that we have seen a number of these patients coming to us and asking whether or not they can be a candidate in our study. Hence, this is how I think KMC wanted to share this knowledge with your viewers and a lot of people in Malaysia to understand why and what is it that UKM is being doing with all this stem cell research that people are talking about. So why is it that we are able to talk about it? I think it's very important to understand that as a university hospital, as a research hospital, we are able to do all this because this is what we are supposed to do. As opposed to be a normal hospital in the Ministry of Health or even a private center. Our focus is more of finding out new things, researching new frontiers and new technology in order to alleviate the suffering of mankind. So this is how I think our 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 leaders, the leaders of UKM actually push us and actually promotes us to do more research and more research that are relevant to the community, not just to come up with publication or grants. These are real research that will benefit the community, especially if you talk about the current situation of COVID, where people are not going for surgery, hospitals are closed, people not be moving around, and then all these problems will end up with patients having pain, not able to, get the medication. I think we are becoming more and more relevant in terms of the context of what we are doing now.
Okay, Dato. Okay, a question from a sportsman. I am 43 years old, and I've got a popping sound but no pain. Should I come and check?
Popping sound.
Popping sound.
Usually popping sound is quite common, and okay, cartilage injuries usually insidious. Insidious means you will not have the pain like immediately when the first time you had it, but throughout time, months, weeks, whenever you do something extra or out of the ordinary, such as going for a run or going hiking, coming back after completing it, you will have knee swelling. And usually that swelling actually can last for a few days. And after that, you are okay. You can still function, walking and doing a lot of other things. But other when you get back to your active lifestyle gain, like running and everything, and you have that knee swelling coming back and forth. That is usually the telltale sign that the cartilage is actually is having some problems. The other thing is that the usual symptoms that a lot of people has, especially sportsmen, is the going up and down the stairs. All right, when you have pain, when you go down the stairs or going up the stairs, that is actually your patellofemoral joint screaming pain at you.
Again,
right? What
was that?
Your patellofemoral joint screaming pain at you because the patella or your kneecap actually is rubbing against your femur while you are going either up or down, or in certain position is your femur on your rubbing against your tibia. But whatever it is, especially when you're just about to go down, you want to test you have problem when you are squatting, you have problem when you do your lunges, you have problem when you do your what do you call it? Going down the stairs or jumping. So these are the things that usually sportsmen do have.
See. Dato, there's another interesting question. This one. This is from Siti Norain. Dato, what is the difference between stem cell treatment with PRP?
Okay, yeah, very good question. PRP is a treatment where you use your own platelet. All right, when the doctor takes your blood and then they spin it, and then they take the portion that actually is being centrifuged, which we call the puffy coat, which is then is actually the PRP, platelet-rich plasma. Okay. The key word here is that your own blood. All right. So when you take your own blood and do it, usually for certain conditions it is okay, but there are many for instances like for the knee injuries, for acute injuries they might be still okay, but for osteoarthritis and other chronic injuries of the knee, I would rather say that there are many conflicting results, on both sides of the agreement. Okay. Because mainly you're not if they, for instance, in a conference that I went, one of the researchers showed the same person who's been taken blood, and his blood is being sent into or is being processed by 10 different containers that actually being provided by the companies to produce the PRP. So when they tested the results, all 10 produces different results.
Oh, but from the same person?
Same person, but different containers, different method. This one spins 2,000 times per second, this one spins 100 times, this one spins for 5 minutes, this one spins. So every container has got its own features. So that particular study was actually very interesting because it showed that from one person, when you tested it in 10 different type of containers provided by different companies, it yielded different results. So I think from there, I think we could see that what actually happens is that it is not being able to quantify the same results every day and every time. Even ourselves, if we take our own blood, like earlier of the year, and then if we have 4 seasons, maybe we take it during winter, during summer, it also might come up with a different result. So having the mesenchymal stem cells sourced from the umbilical cord, and the number of cells are being quantified, I think this is a much better way to have it standardized, rather than, and all the age of the cells are the same, which is newborn, as compared to if you have like a patient who is 70 years old, 50 years old, 20 years old, 30 years old. So your stem cells are actually according to your age, I guess.
Yes, Dato. So we have another question. Salam Dato. Is the
Salam.
is the effect? I'm sorry, I just need to. Is the effect permanent? Do patients have to undergo a few stem cells according to their age group?
Okay. Well, the answer that I would share is that from our research, um, most of the patients we only injected them once. All right, but considering that the second study we had, the patient's age on average about 60, we would understand that their activities are much less, or they are less demanding patients. But having said that, their condition is not much better in terms of we need to start off with. So we always compare the stem cell treatment that we utilize versus the standard treatment that is available in the market today. What we're actually addressing is the treatment gap. Treatment gap is that when the time you, for instance, I take an example of osteoarthritis. When you first start to have pain in your knee joints due to when you're active, or let's say you don't have any other ligament injuries. Say you are 40, so you are taking supplements and everything. If let's say your osteoarthritic changes is bad, um, the only thing actually that separates you between the condition to the the knee replacement is basically not much that you can do. So this is the gap that we are trying to fill in order to help patients to regain a semi-permanent condition of pain-free, and some of our patients are able to get back to their extreme activities. For instance, there was one patient who is a 60-year-old teacher. She was just 1 year before her pensionable age. She went on to climb the Annapurna base camp after well, after surgery, aligning the knee joint and stem cell. So she was happy, and in fact, I was very happy for her, and we were praying for her that she won't, hurt herself. But she was able to be more happier because she's able to do all the things that she ever dreamed of, especially after when she's retired.
Yes, for someone who's 60 years old to climb Annapurna, that is I would say that's an achievement. So one more question, Dato. Hi Dato, I suffered knee injury since last year, August, during futsal.
How young are you?
Okay, he doesn't say here, but went to see the doctor and physio a couple of times, but still can't recover. Also did PRP twice. Easily injured again and pain on bigger movements. Felt fragile and unstable. Should I go for stem cell treatment?
Yeah, okay. So if the knee is unstable, usually it denotes one thing. Most likely you have got a ligament injury, because there are two main ligaments in the knee, apart from the ones outside. We have anterior and posterior cruciate ligament. So if you have injury to these ligaments, as well as the cartilage, usually ligament injury does not give you pain after a while. It only makes your knee not stable. But if your knee becomes painful and unstable, so most likely it's either your cartilage is injured and or your meniscus. So and especially when PRP doesn't work, and all other injections and medication does not relieve you of the pain, most likely you need to go for further checkup by having an MRI done, and most likely, yes, we need to address the problem. But if you have an ACL torn, so your ACL needs to be reconstructed to get your stability back, and only after that your cartilage can be properly managed.
Okay, I hope that answers your question, Mr. Terry. So now, Dato, I'm sure the viewers would like to know this. How can I get the treatment at UKM Specialist Center?
Okay, we are going for another what do you call this? A clinical trial. One is for we are applying our UKM Research and Ethical Committee has approved one clinical trial for cartilage injury, and we are also in the process of getting another clinical trial approved on osteoarthritis. So the clinical trial actually wants or is recruiting patients, all right? And in fact, we have patients who are already in the waiting list. But you have to understand, clinical trials, the good thing is that the treatment that you get is basically free, right? You don't have to pay for the stem cells. The only thing is that as a subject, you are supposed to be monitored by us, and there are visits that we would want you to come, and we will also get you to answer a set of questions and be interviewed. But at the end of the day, you are able to continue with the study if you are okay with it, and at the same time you can always opt out of the study at any one time, because it is your right. And in this study that we are going to do, it is mainly called randomized control trial, whereby there will be two groups. One, the first group will be the ones that are actually going to be getting the treatment of stem cell. The other group is not going to get the treatment or the stem cell, but they will not know that. This is where is the understanding of being a subject in a clinical trial is very, very important and needs to be explained thoroughly, because most patients will feel, why didn't I get the cell, or why is it that I don't feel like I'm getting treatment? Sometimes these are the things that we have to really, really explain in order for you to understand. Please do come and visit us, and we will do the assessment so that you are able to understand what are your options. But not everyone will need the stem cell treatment, because some of them might not be that severe, or might not be as bad as what you think, right? Some of the patients actually does fit the criteria for this kind of treatment, because it helps, like the patient with the heart post heart surgery. Yeah.
Okay, Dato. If I agree to this stem cell treatment, how and where should I start?
I wish we have a one-stop center here in UKM, because as you know, UKM, we have got the public and the private wing. The public wing we have clinics, and of course the private wing we have clinics. The only difference is that in the private wing you are either you can get the appointments much faster, but you have to either be covered by insurance, or you are with a panel, or you are going to pay on your own. Whereas in the public side, you do get highly subsidized treatment or for consultation, but the only setback is the waiting list for the appointments. So I think we will we will try to get the best way for one stop center for patients to, after the inquiry, and then they can be channeled to be seen
Okay.
by me at least.
Okay, so that's let me see. There's one more question. Dato, can stem cell be used to treat ACL injuries?
Outright, if it's torn, technically no.
Okay, if it's torn, then no. Okay, so that's 1 hour of
Wow.
discussion. Yes.
That's 1 hour. Wow.
Can I
That was
receive
fast.
can I receive stem cell treatment for my knee pain? So maybe you can wrap up about our discussion today.
All right. Okay, Zal. I think the message for today is that I hope the public understands that how UKM or Hospital Chancellor Tuanku Mukhris or UKM Medical Center is able to embark on this breakthrough treatment of using mesenchymal stem cell of allogenic source for patients, mainly is because that we are a research hospital, a research university, that all our activities are being monitored and verified and approved in order for us to get the objective desired. And of course, patients' safety is our utmost concern. We follow the Helsinki Declaration of human clinical subjects, whereby I would quote in one of the point number 32, that is, when there is no available treatment, either therapeutic or prophylactic treatment, or is available for a patient, the doctor or the patient is allowed to utilize experimental or non-proven treatment for the patient, for as long as the risk has been safely studied and the patient is well informed, in order to alleviate sufferings. Okay, so that is how we are looking at stem cell treatment, as in an experimental treatment rather than a standard treatment. Because as a standard treatment, if it's a standard treatment, then the insurance has got to cover for it, and the panel has got to pay for it. But as an experimental treatment, mostly is at the prerogative of the insurance whether they want to cover. But mainly patients are supposed to get the treatment at their own cost, which I think what UKMSC is doing is very noble, because we are also helping for patients to make it easier for patients to get this kind of treatment if they were to pay on their own. Yeah.
Okay, so a lot of our viewers are probably asking what is the cost of the treatment?
That one, the cost of treatment.
Yeah.
The cost.
Come to your clinic and get a consultation.
Yeah, I think like I said, if you're enrolled in the study, well, it's free if you're enrolled in the study. All right. So if you want to I think if you want to pay for the treatment, provided that all else has been discussed and all the risks has been evaluated properly, I think the treatment is ranging around 15,000 for knee.
For one knee.
Yep. And it's like if it's an osteoarthritis, you come and then you inject and then you go back, kind of thing.
So you can go on with your daily routine after the injection.
You need to rest for a few days, and the first few days, what we observe when after the injections, within the first 48 hours, the pain is quite intense. But patient is allowed to go home, and ice compression and some Panadol will be able to relieve you the pain, and also compression. And the pain will immediately go down. The first day is actually first 24 hours. It can be quite painful. Not all, but I think about 60 to 70% of patients do admit it's quite painful when the knee becomes very swollen. But after 24 hours, the pain becomes much more bearable, especially when you continuously put ice and compression. Within a week or so, you should be able to function quite normally. And after 2 weeks, you start doing the exercise, and all the way up to 2 months, you should be able to see improvements in terms of your knee pain.
Okay, thank you so much, Dato, for your time today.
Thank you.
Let me just summarize that. So treating knee pain at UKM Specialist Center, it's non-invasive, it's a day treatment. Am I right, Doctor? And for more information, you can follow our Facebook, UKM Specialist Center, and also Instagram, UKM Specialist Center. And also you can call 03-9174 9222. I repeat, 03-9174 9222 from 8 a.m. till 5 p.m. on Monday till Friday. And you can also WhatsApp our customer service 012-914-5030. I repeat, 012-914-5030 from 8 a.m. till 5 p.m. So that's all for today. And if you are happy with our Facebook Live today and you would like Dato' Bat to come again and speak, you can share this to your family and friends and also repost this. We would really appreciate if you could repost this on your Instagram, Facebook, send it to your social media. And thank you so much, Dato', for your time. Thank you, viewers. Thank you, viewers, for today. Thank you.
Okay, bye.